Pediatrics, Sir, kindly come on the stage and introduce our speakers for debate, Dr. Mamta Jazu ma'am and Dr. Anurag Thomas sir.
India, she got Chickesa Rapunava, Delhi Medical Council for MBBH and Committee for Clinical Trials and many other more than 40 publications in the national and international journals. She also had more than 10 chapters in the various books of genetics and neurology. She is principal and educator for many multinational national and international trials which are aligned with the ICMR and Northern Research Association.
Organizes for me because coming to our own medical college is really the moment of pride for us to be here. So thank you sir for calling us here. So the very important topic which is the competency-based medical education for postgraduates. Is it? So for the motion I am speaking about is, I want to say that CBME is not just a reform, it's a revolution in postgraduate training. Because we need, the society does not need doctors who just serve their life. It needs doctors who are truly competent. So what does this competent mean and are we really achieving this? So our aim of medical education is to train students to efficiently take care of the health needs of the society. This not only requires knowledge. We know all that we don't want only knowledge in the medical field. We want learning, skills, communication and ethics. So with changing healthcare needs also. So coming out too many corporates, too many knowledgeable people and ChatGPT telling everything to the patients and their attendants, we need expertise in our field, more of a clinical expertise and skills in our field. So are we good enough that if we have traditional teaching or with increasing PG number seats, which we need to give a system like more than 70,000 PG seats now LMC has. So we need a system which has uniformity. So we will come out with a postgraduate teaching where the outcomes will be standardized, where the feasibility is there to have a long-term specialist. And we should have a big picture to transform education from times up to competence achieved. So how can this all be achieved? So I just want to ask the students, have you gone to the traditional teaching? Are you still having the traditional teaching? Or you have now moved from traditional teaching to the competence piece? I think it's mixture which is going on in most of the medical colleges. But if we go to the traditional teaching, is this as oriented towards outcome? It's the current curricula explicitly define, address, ensure all desired outcomes. Does it ensure that postgraduates have acquired all the necessary abilities? Does assessment scores assess all domains of learning? Is medical education transparent for teachers, public and others? Are standard criteria oriented? Are our students getting enough training for practice? Are we teaching them or facilitating them? Is there a good criteria to measure all these or is there a system of feedback for them? So our current medical education system is more of teacher-centered. We all know that. So the professor is there and students are there and still that mentor-mentee relationship which ma'am has talked about in the last lecture is still, I don't think is existing very much. Curriculum is subject-centered and time-based. It's a time-based, we know that we have to give 3 months to this, then ICU hosting and teach whatever we can do, or to the wards or to the emergency. Most evaluations are still going on summative. No system for feedback. The teaching learning activities focus more on knowledge than on aptitude and skills. Also like the soft skills related to communication, doctor with patient relationship, ethics and professionalism. This is highly lacking still in our system. No standardized benchmark upon which a student is to be taught or assessed. Are we assessing or are we teaching up it? So coming to this traditional teaching still going on, I feel we need to have a mentor-mentee relationship and we develop a system where we should facilitate them or motivate them and hold them as like not a student but as a peer. So Adaptability to change is itself a hallmark of successful education. So Peter and that change has started. The NMC has started that change in 2019 and introduced that competency-based learning for all students. So this competency is defined as the ability to do something successfully and efficiently. CBME is to ensure that the graduates develop the competencies required to fulfill the patient's need in the society. And this has been started, and since then, it's mainly focusing to apply knowledge, skills, attitudes effectively in real world context. So the competency based, if we see, it is CBME is sort of integrative. It's not only one system or one thing you are learning. You are learning too many things together. If you are seeing one patient, it is related to neonates. If it has a surgical problem, if it is involved skills related to that, it is individualized. It is learner-centered. It is not, and the most important thing is that every student is not of the same capability. Every learner is not of the same capability that we treat all the students in one category. Some are quick learners, they learn very effectively, efficiently. Some are slow learners, so we need to take care, and CBME take care of these things. It is work-based and outcome-based. So the most important thing here is it is an outcome-based learning. So we need to see that what all we need to teach them and the outcome is according to that or not. So Indian Medical Council I have described this, the competency. The clinician one is who understands and provides preventive, promotive, curative, palliative, holistic care and compassion. Leader and member of the healthcare team and system with capabilities to collect, analyze, synthesize and communicate health data appropriately. Because we all know that it's a very important. Doing clinical work is not sufficient. Collecting data, analyzing them and interpreting them is again very important part. We need to have a good communicator, good communication skills so that we can talk to patients, families, colleagues and the community. And we should be a lifelong learner. There is no age where we can say that we should stop learning. At every point, a student or a teacher both need to learn and go ahead with this. And we should have a professional attitude in our day-to-day activity and everything. So the CBSE, the points are that it has focus on outcomes, not duration. So, as I said, traditional systems are time-bound, competence with experience, but CBME is outcome-based. So, ensuring every trainee actually demonstrates required skill, knowledge and attitude. It produces safe, independent and confident specialists ready for real-world practice. So, our aim is that once our PG and the SRs, when they go out of the system, they should be confident and they should not do any harm to the society by doing wrong practices. So they should learn in the way that they are doing right practices. Learner-centered, as I said, that learner, they need to learn, self-directed learning is there, but we need to encourage active self-directed learning rather than passive absorption. Promotes accountability and lifelong learning methods. It is, the third most important thing is that it has a continuous assessment which builds the confidence. So regular formative and feedbacks, which are very important. So I think the preparing the logbooks and doing the regular formative assessments, giving the feedbacks, one-to-one feedbacks to the students by various methods which have been discussed since morning is a very important part of the CBME. Simulation, so simulation labs, skill labs, hands-on practices, and not doing on the patients, we are doing on the simulators. Give them more, reduces their anxiety and give them more confidence and competency. Enhances procedural and communication confidence, especially in higher risk specialties. So doing hands-on practices, neonatal resuscitation, pediatric advanced life courses, putting lines, central lines, many on simulations, skill-based trainings is really helpful in this. Then competency, milestones and interests. So it's a very important part of the CBME. It reduces the examiner bias and improves the fairness, and it facilitates the standardization. So I like one students, I'll not be able to give that student more marks or the other less marks if the system is proper. And it aligns with the global standards. So these things which NMC has started in 2019, it's running in the international world since 2015. 1949 or 1950. So the Canada was the first country to start this type of education. So it prepares graduates for international practice and collaboration also, and it is adopted by the many other international agencies. It improves patient care and safety. So once we know that our postgraduate is confident, he is ready to be served in the society, he is confident, competent, so the errors will reduce a lot, and it reinforces professionalism, ethics and communication. Ultimately, it benefits the patient and society and fulfill the true goal of medical education. Promotes reflective practices. So once you give, they fill their logbooks, they get the feedback, so they know that what they are lacking and how they need to improve on themselves, and they build the ability to evaluate one's own performance. So CBME, it's testing all the domains. It is not step by step, it's going together. It's integrating the knowledge and the skills which we want, and it is giving the confidence through competence. When learners see themselves achieving interestment in real tasks, confidence follows naturally. So competence builds confidence, not the other way around. Graduates emerge ready to handle independent clinical responsibility. So there are so many methods available how to do assessments also. So in the last, I just want to say that CBME, it's developed strong clinical skills, well equipped to work in multidisciplinary teams, handle and analyze information and more. It has the potential to drive better outcomes just in the classroom, but in the clinic and the population level. Contribute to reduce burnout among physicians also. So CBME transforms doctors from time-bound trainees into outcome-based healers, not just qualified but truly competent and confident. So thank you so much. So I feel that I want to read this quote because there should be a relation between the mentor and mentee, and the CBME is the right way to develop that. The relationship between mentor and disciple can be linked to that between a needle and thread. The needle leads the way to the cloth, but in the end it is the thread that remains and holds everything together. So being the teacher, it's our responsibility that how we hold our students and how we take care. Thank you so much. Thank you.